Hi guys, and welcome back. In this video, we're gonna talk about the male reproductive system, we're gonna talk about the gross anatomy, and in the next video, we're gonna talk about the histology of the male reproductive system. Now, before we go ahead and talk about the parts of the male reproductive system, let's go ahead and see what happens with the peritoneum when it comes to the pelvis of the male. Remember that when we talked about the peritoneum in the digestive module, we said that the abdominal viscera, they push against a closed serous sac and they attain two layers, the visceral layer that wraps around the viscera itself. So that's why we call it the visceral layer of peritoneum. And then we have the parietal layer, which lines the body cavity, and parietal means wall. So the parietal layer is what lines your abdominal wall. So when it comes down and it reflects on the top of the pelvic organs, it gives you a pouch between the organs you have in the pelvis. And in male, we only have the rectum and the bladder. So when we have the parietal layer coming over the bladder and forming a pouch, which means a pocket between these two organs, and reflects back up on top of the rectum and it goes up back, it's going to give you a pouch, and that pouch is what we call the rectovesical pouch or vesicle. All right, it depends on the pronunciation. All right, so this is the peritoneal reflection, and this is the pouch. You get to have it in males. Now, to talk about the coverings of the testis, we need to start our talk about the system by the testis, because testis is the most important organ we have in the male system. All right, so we need to know that we have coverings on the top of the testis, and that starts with the testis itself as it forms in the abdomen. So in the abdomen, you have the testis, and remember that the testis were forming in the abdominal cavity during the development, and they attain three layers during development at the start of the migration. And these layers are basically your first one is basically the tunica albuginea. Tunica albuginea means white. Tunica means layer. So the tunica albuginea is a histological structure that is a connective tissue layer around the content or the parenchyma of the testis. All right, so the tunica albuginea is a histological, so we cannot see it here in that in this gross anatomy picture, and that is the connective tissue that's all around the tissue of the testis itself. So during the migration, you guys know that from the previous video that we talked about the gubernaculum in the female, and how this gubernaculum was a fibrous band that was trying to pull the testis all the way from the abdominal cavity through going through the inguinal canal all the way down to the final destination, which is the scrotum. So that is the gubernaculum. And because the testis was pulled off by that fibrous band, guys, remember that we had the peritoneum, and the peritoneum is where you have it was in your abdomen, and your organs were pushing against that. The same idea happened with the testis, and when the testis was trying to push against the peritoneum, remember it was a closed serous sac, and as it pushes against this, it goes all the way out. So it's gonna attain two layers from the peritoneum, all right, at their origin, and that was coming from the peritoneum. And remember that we had the visceral and we had the parietal layers. So we will have something called the tunica vaginalis, and the tunica vaginalis because it invaginated the parietal and the visceral layers, visceral and then the parietal layer of the peritoneum. So we called it's a layer attained by invaginated the peritoneum. So that's why after the tunica albuginea, we attained the tunica vaginalis, the visceral layer, and then followed by the parietal layer. So if we were to say the layers that are covering the testis, the tissue of the testis, at the start, at the origin, at the start of the formation of the testis, it's going to be the tunica albuginea, the visceral layer of tunica vaginalis, and then the parietal layer of tunica vaginalis. So if we open the scrotum, at the destination side, guys, what you can see here is the tunica vaginalis visceral layer, because this is my organ. So this is my viscera, all right? And if I were to see something that lines the next group of coverings, that's gonna be the parietal layer of tunica vaginalis, all right? So here we have three coverings of the testis at the origin of the testis. Now, during migration of the testis in the inguinal canal, remember that we had the inguinal canal, all right, so the inguinal region in the canal, you guys know that the canal was formed by the layers of the abdominal cavity. And in the abdomen, we had three muscles. Remember, the external abdominal oblique, the internal abdominal oblique, and the transversus abdominis. All right, so we had the fascial sheets of the three layers, and we call them the external oblique aponeurosis, internal oblique aponeurosis, and transversus aponeurosis. Now, as we migrate, all right, we are coming from inside the abdomen and we're going outside to reach the scrotum. So we're going to attain the same layers, but we're going to change the names from the abdominals into spermatic, all right, because this is going to form now my spermatic cord and the coverings of them. So as the testis comes in to the inguinal canal and coming out, we're going to get more and more layers. We're going to get the first layer from the deep inguinal ring, which is the internal oblique, because we're running inside to outside. So remember, we were getting from the peritoneum, and then coming from inside to outside, we will have the transversalis fascia that will give you the internal spermatic fascia, all right? So if you look at the red one, which is the fascia transversalis, it's gonna give you all the way here, the red, it's basically your internal spermatic fascia. You're gonna attain it as you enter the inguinal canal, and then as you proceed in the canal, you're gonna get another layer, which is coming from the internal oblique fascia, and that's going to give you the cremasteric muscle and fascia. So now the cremasteric muscle and fascia are coming or deriving from the internal oblique muscle and fascia, all right? And this is going to be the next layer. You get it during your migration, and then as you come out of the canal, you will get the third layer during migration from the external one, because we are moving internally to externally, and that is from the external aponeurosis, and that's going to give you the external spermatic fascia. So the green one is basically coming from the external oblique fascia, and this is basically your external spermatic fascia. So at the beginning, we had at the origin, sorry, three coverings, and during migration, three coverings, and as you reach the scrotum, you're gonna get the last three coverings, which are basically related to your scrotum. So what's gonna be in the scrotum? And this will take us to the next topic, which is the scrotum itself. It's basically your skin, all right, and the subcutaneous muscle and the fascia that covers the testis from the scrotum side. All right, so you have the skin, you have your dartos fascia, which was basically coming from a continuation of the fascia of the abdomen, because remember, in the abdominal cavity, we were having skin and superficial fascia, and the superficial fascia in the abdomen, it has the Kumper's fascia, which is the fatty layer, and then we had the Scarpa's fascia, which is a membranous layer. The Kumper's fascia, which is a fatty layer in your abdomen, it stops. It does not continue down. But the Scarpa's fascia, it continues down all the way up until it wraps around your genitalia and it turns back. So if we were to talk about the coverings of the testis at the destination, it's gonna be your skin, all right, the deep membranous layer that continued down, which was coming from the Scarpa's fascia, and it's gonna be called here the dartos fascia, and as it turns back, it's gonna be called the collis fascia, all right, and then you have your subcutaneous muscle, which is the dartos muscle. It's subcutaneous because it's below the skin, and that what causes the wrinkles of the skin, and it's very important in in the regulation of temperature of the testis. And if there is if the testis is coming into low temperature, a contraction of the dartos muscle will contract the skin here. It will reduce the exposure of the blood vessels to the surroundings to try to kind of preserve the temperature in the testes and protect them, because you guys know that we need to maintain optimal temperature of 2 degrees below or less than the body temperature, which is around 35 degrees. And if that is disrupted, we're going to have problems with the sperms. And thanks to the cremasteric muscle and the dartos muscle, the subcutaneous dartos. So the dartos muscle is basically subcutaneous. It's all below the skin of the scrotum itself. So the dartos muscle where this is at the scrotum size. This will cause wrinkles of the skin, reducing the evaporation of the temperature of the blood vessels of the testis. And the cremasteric muscle, which is running inside the canal itself and going all the way down around your testis. It's not your testis, all right? It's only for male testis. All right, so this is going to contract, and when the cremasteric muscle contracts, it brings the testis near to the body to if there is cold weather or if there is cold environment. And when we bring it near to our bodies, I mean male bodies, we are going to raise the temperature to maintain it in the testis. All right, so this will happen to try to maintain an optimal temperature for the sperms, in order not to for them to die. All right, so I had another thing in my mind, but I think I forgot it. All right, so this is the whole idea about the coverings of the testes. This is how you guys can remember them without memorizing. It's very simple and easy. If you just know that we have 3 coverings at the origin, 3 during the migration, and 3 at the destination, it will make your life easy to remember all of this stuff. And of course, this is your testis, and this is the epididymis sitting on the top of it, and this is the spermatic cord. And as we proceed, if we think about the testis and what would happen in the testis, we're going to have an idea about the structures that would be seen in the spermatic cord. Now, think about the spermatic cord content as anything that is related to the testis and the cremasteric muscle, because you guys know that the cremasteric muscle comes all the way and it wraps around the testis. So if I were to have a testis here, the spermatic cord should be my channel of bringing stuff from the abdomen all the way to the testis, or bringing stuff from the testis itself to the abdomen. So what do you think we will have in the spermatic cord? Of course, we're going to have the testicular artery, right? Because the testis was developing in the abdomen, and it was getting its arterial supply from abdominal aorta, right? Because aorta is what supplies the abdomen. So we were having the right and left, all right, and we're going to talk about the arteries in a separate video, and that was giving the testis. So I would expect to see the testicular artery and also the testicular vein. Of course, testicular veins are actually around 8 veins. We call them pampiniform plexus. They wrap around the testicular artery. These are the bluish ones, and they are around 8, and then they ramify and they are uniting together to form around 4. And then here at the beginning of the inguinal canal, they form around 2, and at the end of the inguinal canal, they form 1 testicular vein that eventually drain into the abdomen. All right, and the right and left renal veins. Now, so I would expect to see the pampiniform plexus of veins. I would expect to see the testicular artery. I would expect to see the nerve that supply the muscle that needs to take care of the testis, which is basically my cremasteric muscle. And that nerve is basically my genital branch of genitofemoral nerve. And it makes sense it's a genital because it's going to the genitalia. All right, I would expect to see the sympathetic fibers the artery of ductus deferens, because ductus deferens is the thing that is going to bring the sperms from the testis all the way to the next destination. We're going to talk about the journey of the sperms in a while. So the ductus deferens is expected to be seen here in the spermatic cord, and of course the artery that needs to supply it, which is the artery to ductus deferens, and this is actually a branch of inferior vesicle. We're going to talk about the arterial supply in a separate video. So the last thing is the vestige of processus vaginalis. Remember when we talked about the gubernaculum and how it pulled the testis out of the abdomen to the final destination? Remember when we said that it was pushing against the two layers of peritoneum? So the peritoneum, the tunica vaginalis, we're gonna have one that wraps around the testis, and this is the parietal and visceral layer. And as we proceed and come here, we will have a small piece of that membrane, and that is going to form a band. And this is a remnant of that band is what we call the vestige of processus vaginalis. It should actually be obliterated. It should not be opened. Otherwise, it will need surgery because it's clinical emergency. All right. Now, what happens to the sperms as they form in the testis? The sperms are going to be formed in the testis. We're going to talk about that in the histology of the testis and see how do they form. And as they form here, they're going to come out of the testis by the straight tubules, and from the straight tubules to the retitestis, all right, up there, and then from the retitestis we get them into the efferent ductules. From the efferent ductules, what do we mean by retitestis? It's basically something at the back of the testis. So these are all tubules draining the sperms formed by the testis all the way to the something. And you guys know that efferent means something that takes something away from the organ. So we're gonna call it the efferent ductules. It takes the sperms away from the testis, taking them to the next organ, which is the epididymis. The epididymis is going to receive the sperms. They will learn how to swim. They will gain maturation, get stored, and then when they are ready to be ejaculated, or once they are ready to move on from the epididymis, they go all the way by the ductus deferens, all the way, and this is the ductus deferens, and then they move in the inguinal canal, and then once they get into the pelvic cavity, they will come all the way, and then the duct of the ductus deferens will unite with the duct of the seminal vesicle. Together they will form the ejaculatory duct, and the ejaculatory duct of the right and left will open into the prostate, and this is in the prostatic urethra. All right, and prostatic urethra now becomes a common passage for the urine from the bladder on the top of it, and from the ejaculatory ducts. And then they would, but of course they are not going to get out at the same time. All right, and the sperms will get extra secretions from the seminal vesicles. So we will get more secretions from here and more secretions from the prostate, and then they would proceed from the prostate here to the next to the membranous urethra, and then penile, and then they come out of the penis during ejaculation. All right, so this is the journey of the sperm.